elaborate on that?
See, hemophilia basically occurs from a deficiency
Okay.
of a protein in the blood. And that protein is deficient since birth.
Okay, all right.
It is deficient because it is not being manufactured in the quantity that it is required to be. And the reason for that is the message that comes from the genes to make that protein in the body, that message is not coming because the gene has got damaged.
Right.
So basically the cause for the hemophilia would be a damage, or what we call a mutation, to the gene which is responsible for synthesizing a protein, and that protein gets deficient in hemophilia. The protein can be of many varieties. There are more than dozen proteins, but for hemophilia there are two that are important, and they are identified by the Roman numbers 8 and 9. So if it is 8 that is deficient, we call it hemophilia A. If it is 9 that is deficient, it is called hemophilia B. So largely it's a disease which runs in the families because there is a genetic mutation. Having said it, we must warn those who do not have a family history that this can occur de novo in those families where there is no history also.
All right. Now,
Because there is a new mutation that sets in.
oh, okay. So largely this is genetic in nature, but in some cases it may not be so. Right.
No, it is genetic in nature in all the cases.
Yes, but
in some,
yes.
in most of them, 2 out of 3 cases, 2/3 cases, there is a positive family history
Okay.
of that mutation,
Okay,
because it is
okay.
running in the families. But in some of the cases, there is no history, but the mutation comes in as a new mutation.
That's right, right.
And then it starts
Then
running
again
in the
it becomes a
subsequent
genetic,
generations.
yes, correct. Okay. Now, since he just explained that it's
Very
together.
painful.
Right, right.
So they are so painful that slight movement of it can cause more damage. So one is that area is to be stopped from moving, what we call splinting. One can take any twig, any stick, any plank, any wooden, or one of those scales, and tie it. And so that's rest, giving rest to that area, and splinting is one of the very important things. Another thing that helps in these persons when they get the bleeding is to put some
before they turn into something severe. So don't go away, as we are coming back in just a moment. Talking about hemophilia. Well, we heard as to what are the types of hemophilia and what are the symptoms that emerge. But now Dr. Gupta is trying to tell us as to what is the immediate first aid that needs to be given.
It can be placed there for 5 to 10 minutes, and then it should be removed, and it can be reapplied there after another 10 minutes. There are 3 applications which would be required. You can do 3 or 4. Meanwhile, one should try to get access to the factors or to the nearby treatment center where one can take the injection, and this injection contains the protein which is deficient in patients with hemophilia. So the moment this protein as injection is injected into their body, the bleeding stops. There is no further bleeding, and the matter starts subsiding. He starts feeling the relief. Of course, we give painkillers during this time. So all these things, except for administering the injection, can be done in the school setting, or even in the work setting, in case these are adult
home,
persons,
wherever
or
this
even at
occurs.
home. So if person understands it, it is well and good, and if he carries a card, well and good. In fact, the cards that we give to the patients with hemophilia, that carries all these instructions at the bottom of it. So even if somebody sees that, these instructions are there in Hindi and in English. So schools have to be actually created more aware for making a better environment for these children who actually need to learn more. And just like any other persons with disabilities, these are the children who learn much faster, much quicker, and they are more enthusiastic.
Right. Now, Dr. Yadav, what is the role of an orthopedic in managing a case of hemophilia, especially if he just comes to you with a bleed?
Thing is that most of these patients, they comes to orthopedician first. Even they are diagnosed as a orthopedic problem. And by the 1 year, most of these patients 1 year or 5 years, knee joint is involved first. Large joint, especially knee joint, is the most common side